and make sure that we are good to go. When I get a few responses into the question box, we'll go ahead and move on to the next page. All right, excellent. Some people are already typing in the question box for me that we are good to go. All right, so for those of you who maybe this is your first time at Question Clinic, or maybe you're new to the program, welcome. We are so happy to have you here, hoping that today will be just an informative day, that you'll learn something. If you learn one thing from today's session, I consider it a successful day. So how is Question Clinic going to go today? Well, the first couple slides are going to be informative slides. I'm just going to talk to you guys about some NCLEX information, about some testing strategies, and then we'll get into the questions. I will present a question to you. I will read the question along with the answers. I will give you 2 minutes in order to put your answer into the question box, where I will be monitoring and reviewing all of them as they come in. After 2 minutes is up, I will unmute myself, come back on. I will reveal the correct answer to you, and then we'll discuss a little bit as to why that one's correct and why maybe the other ones are not the best options. The first 5 questions are going to be standalone. The last 5 are going to be embedded in a case study that we will talk through together. Okay, you're more than welcome to ask questions as we go throughout today's presentation. I am trying to view them as I'm speaking as well, so please forgive me if I don't see your question. At the very end, if there is time, you are more than welcome to restate your question in the question box, okay? All right, so what this screen is showing you is the NCLEX categories and percentages. The NCSBN, which is the governing body of the NCLEX, has given us exactly what percentage of each category the questions are derived from. So the information on the left and the right hand side of the screen are the same. Left hand is in the table view, right hand is in a pie graph view with some colors. So for those of you who like colors, you're more visual people, that is the one for you. So basically what this does is it's the distribution of the content for the NCLEX exam. You have 4 major client needs categories, which are safe and effective care environment. This one has 2 subcategories, management of care and safety and infection control, and you can see the percentages listed there. Second client needs category is health promotion and maintenance, then psychosocial integrity, then physiological integrity, and as you can see, this has 4 subcategories: basic care and comfort, pharmacological and parental therapies, reduction of risk potential, and physiological adaptation. And you can see the percentages listed there. On the right-hand side of the screen, when referring to the pie graph, you can see how some of the categories are larger. Management of care is 18%, pharmacological and parental therapy 16%. But don't dismiss those categories that are on the smaller side. Psychosocial integrity, basic care and comfort. You could have a basic care and comfort question that is the deciding question of a pass or fail in the NCLEX exam. So even though there are a fewer amount of questions derived from that topic, it does not mean that it is any less important. All right, moving right along. So physiological integrity is what we are going to be talking about today. There are 4 subcategories, as we just spoke about on the previous page, but today we're going to be focusing on first on basic care and comfort and physiological adaptation. So what does that mean? What could the topics be from those categories? Well, basic care and comfort are things such as elimination, nutrition, rest and sleep, non-pharmacological comfort interventions, assistive devices, things like that. Physiological adaptation could include things such as medical emergencies, illness management, alterations in body systems, and unexpected responses to therapies, just to name a few. Well, if you haven't already listened to your Learn Upon webinar that is entitled The 6 Steps to Question Success, I highly recommend that that is the very next thing that you do after the conclusion of today's webinar. The 6 steps to question success is how we teach you to approach each and every single question on the NCLEX exam. Step number 1 on the 6 steps to question success is determining the type of question. It is so important that you are able to determine the focus of the question, realize what your approach to the question is going to be, and figure out what the style of the question is. If you can do those three things, you are starting out on the right foot. So what is the focus? Is this a delegation question? Did the test question creators at the NCSBN want to know if I can prioritize? Do they want to know if I can teach someone something? Do they want to know if I can therapeutically respond to someone? What is it that they want out of me, basically? What is your approach? Is this going to be an umbrella option or an apples and oranges option? Or maybe it's a fixed word versus flexible. Remember, guys, there are no absolutes in healthcare. So if you come across an answer option that has a word such as always or never, those are fixed words and those can quickly be eliminated because they will not be the correct answer. And then what is the style of the question? Is this a fill in the blank? Is it a highlighting? Is it a drag and drop? So in order to determine the type of question, you've got to ask yourself these three questions. Alrighty, and then therapeutic communication, guys. We talk about this with every single question clinic that we have. Why it is so important to make sure that we are understanding how to therapeutically respond. And this is not just on the NCLEX exam, but as a nurse in the United States, okay, you've got to understand how to therapeutically communicate with others. So we want to respond to feelings and tone, okay? Feelings and tone. Our clients are human beings. We are human beings. They want that connection with us. We want to provide them with information. So data, evidence-based practice. They don't want our opinions. We want to stay focused on our client, not on us as nurses, right? We like to tell stories as nurses, right? We like to explain, oh, well, my grandma did this, so we did that. We want to stay focused on our client and the situation that they're going through. It's okay to use silence and presence. Silence gives us the opportunity to process information. Sometimes we hear the phrase awkward silence because sometimes it's awkward to people sitting in a room and there's complete silence. But research shows that it is very therapeutic in the healthcare setting. Do not ask why questions. Why questions could come across as being judgmental. We don't want to ask yes or no questions except in the case of possible self-harm. So if you have a client and you believe that your client is at risk for harming themselves or someone else, that's the only time in which it is appropriate to ask a yes or no question, because you need their response, and then you need, if the answer is a yes, to immediately put a safety plan in place. Do not explore. Again, exploring could come across as being judgmental. And do not say don't worry, because we don't know what's going to happen in the future. And we don't want to provide our clients with a sense of false hope. All right, so like I mentioned before, the 6 steps to question success. We will review it here quickly, but if you have not already listened to this webinar, guys, I cannot stress enough how important these pre-recorded webinars are to your success. You can access them in your Learn Upon account. Each and every single one of you has access to Learn Upon. It was sent to you when you were registered in the program. Lots of good information on Learn Upon. And I know I'm kind of derailing from the 6-step strategy, but there are webinars for EKG, webinars for calculation dosages, webinars for pharmacology, webinars for the apples and oranges like I talked about, SADA strategy, prioritization strategy. So please make sure that you are taking full advantage of everything that we have to offer in this program by accessing those Learn Upon modules. All right, so quickly reviewing the 6-step strategy for question success. Step number 1 is to determine the type of question like we talked about. Step number 2 is identifying the topic, and you identify the topic as it relates to the instruction of the question, not as it relates to the fluff or the story. Step 3 is you're looking for any keywords or clues that could help you in determining the correct answer based on the topic. Step 4, you're applying your knowledge. You're saying, well, what do I know about the topic? Is this expected? Is this unexpected? Where do I go from here? Step 5, you are reviewing and you are eliminating the ones in which you feel are not correct. And step 6, you are rereading the question with the answer you've chosen to make sure that it actually makes sense. All right, so let's get started on our first question of the day. The nurse prepares to administer an IV infusion of potassium chloride through a peripheral IV per the following order. IV potassium chloride, 10 MEQs per 5% dextrose in water now. Infuse over 30 minutes. What is the nurse's priority action? Number 1, verify the patency of the peripheral IV site. Number 2, check the most current serum potassium level. Number 3, contact the healthcare provider to verify the prescription. Or number 4, set the electronic IV pump to 100 mLs per hour. What is the priority action here, guys? What is it that we are going to do first, okay? Always think safety when it comes to these prioritization questions. So I'm going to give you guys 2 minutes on the clock. Please put your answer into the question box for me. And I'm going to put myself on mute, and in 2 minutes, we'll come back together. Here we go. All right, guys, so coming back together, let me reveal the correct answer to you. So if you chose number 3, contact the healthcare provider to verify the prescription, you would indeed be correct because potassium chloride must be infused no faster than 10 MEQs per hour. So the RN does need to contact the HCP to have this order corrected. So it shouldn't infuse over 30 minutes. It should infuse over 1 hour. So that would be too fast. Whenever you are dealing with dosages, with medications, make sure that you are using your what was 5 rights to medication administration when I was a nurse on the bedside, but I believe it's 7 rights to medication administration now. So make sure you know the right dosage, the right time, the right place, all of those. Review your rights to medication administration. But I see a lot of you put option 1, option 2, or option 4. So let's review those and why maybe they wouldn't be the priority action. So option 1, verify the patency of the peripheral site. The nurse would assess the IV site for swelling, tenderness, or redness just before initiating the potassium chloride infusion. And we're going to be checking every 30 minutes during the administration. However, it's not the priority action at this time. Number 2, check the most current serum potassium level. The nurse would check the most current serum potassium level just before administering the potassium chloride infusion and may obtain another level following the infusion if prescribed. However, again, this is not the priority action. And number 4, set the electronic IV pump to 100 mLs per hour. The electronic IV pump should always be used to administer potassium chloride. To administer the infusion at the recommended rate of 10 MEQs per hour, the nurse would set the pump at 100 mLs per hour, but this is not the priority action. So all 4 of these are correct. 1, 2, 3, and 4 are all correct actions. But what is the priority action here? It's verifying the prescription because it's wrong. It's infusing at a faster rate than potassium chloride calls for. Okay. All right, question 2. Which of the following patients does the nurse anticipate the healthcare provider transferring to the intensive care unit? So who's going to the ICU? Number 1, a 30-year-old with alcohol abuse on IV lorazepam every 3 hours for agitation with a blood pressure of 190/98 and a MAG level of 1.5. Number 2, a 46-year-old with stable angina who has chest and jaw pain relieved with nitro with a blood pressure of 98/70 and dizziness when getting up. Number 3, a 50-year-old with chronic kidney disease who has a blood pressure of 168/88 and a serum creatinine level of 5 and reports nausea and itching. Or an 80-year-old with pressure injury who has a change in mental status, a temperature of 96.4, a pulse of 110, and a blood pressure of 96/72. Which one of these clients is the most unstable, and who is going to the ICU? 2 minutes on the clock, guys. Here we go. All righty, so for those of you who put number 4 as the correct answer, you would indeed be correct. So the approach to this question, you have to say what is expected and what is unexpected. So number 4 would be correct. This is not expected for a patient with a pressure injury. Hypothermia can be the presenting feature of sepsis in elderly clients. Sepsis is a potentially life-threatening condition, and that early recognition and treatment is critical to survival. This is an atypical presentation that is often seen in the elderly clients due to decreased immune function and inflammatory response associated with aging. So with the other 3, because I know some of you put 1, 2, or 3 as the correct answers, let's talk about why. So number 1 is a 30-year-old with the alcohol abuse who's on lorazepam for agitation, has a blood pressure elevated, and a MAG level of 1.5. Well, the MAG level is normal. 1.5 is on the lower end, but it is normal. Hypertension, agitation, and anxiety are all expected. okay, as somebody is withdrawing from alcohol abuse. So these are all expected outcomes. This client would not be transferring to the ICU. Number 2 is the 46-year-old with stable angina who has pain relieved with nitro and a BP that's 98/70 and dizziness. Well, we know that side effects of nitro are hypotension and dizziness. So those are expected outcomes. The client is stable, pain is relieved, and the symptoms that they're experiencing are expected side effects of nitro. So that client would not be taken to the ICU. And then number 3, the 50-year-old with a CKD who has a blood pressure that's 168/88 and a creatinine level of 5 who reports nausea and itching. Those are, again, all expected for a client with CKD. We would expect the blood pressure to be elevated, the creatinine level to be elevated, and we would expect nausea and itching to go along with that, because those are side effects of the disease process. So number 4 would indeed be the correct answer here. Question 3, the nurse assesses the lab results for 4 patients. Which client's fever is of highest priority and should be reported to the provider immediately? Number 1, a patient newly diagnosed with Hodgkin's lymphoma, scheduled for chemo, who has a fever of 100.9 and a WBC count of 6. A patient with acute cholecystitis, scheduled for laparoscopic surgery, who has a fever of 102 and a WBC of 13. A patient with Clostridium difficile, receiving metronidazole, aka Flagyl, who has a fever of 101 and a WBC of 18. Or a patient with colon cancer, receiving chemo, who has a fever of 100.4 and a WBC count of 1.5, also known as 1500. So again, the approach to this question is going to be expected versus unexpected. So 2 minutes on the clock, guys. Who is of highest priority here? 2 minutes, here we go. Alrighty, guys, so coming back together, this one is a little bit on the tricky side, right? Because it's not the client who has a higher fever that is of greatest concern. It's actually number 4, a patient with colon cancer receiving chemo, who has a fever of 100.4 and a WBC count of 1.5. Common adverse effects of chemo is bone marrow suppression and immunosuppression. Neutropenia increases the client's susceptibility to infection. A fever with neutropenia can rapidly develop into life-threatening sepsis. Even a low-grade fever should be taken very seriously in these clients. So number 4 would indeed be the client that would be of highest concern for us now. Several of you put the others, 1, 2, or 3. Let's talk about why those would not be correct. So number 3, a client with C. diff. This is an expected presentation. We would expect for the client to have diarrhea, fever, leukocytosis. A first-line pharmacological treatment does include medication Flagyl and oral vancomycin. So this is expected with a client on C. diff. So they're on antibiotics. We know that the antibiotics, once they start to take them, will help to decrease that fever and the WBC. So this is an expected finding for a client with C. diff. Number 2, a patient with acute cholecystitis who's scheduled for laparoscopic surgery. This is the client that has the greatest fever, okay? However, it's not of highest priority now because we have a confirmed diagnosis. This is an expected presentation, and we have a treatment plan, which is surgery. Acute cholecystitis is that inflammation of the gallbladder, and we would expect for the client to have vomiting, fever, right upper quadrant pain, nausea, elevated WBC. The client is scheduled for surgery, like we said, and is likely on antibiotics. And even if the client is not on antibiotics, neutropenia is a priority over acute cholecystitis. So again, even though this client has the highest fever, they are not of greatest concern. They have a plan and it's expected for this diagnosis. And then number 1, the patient newly diagnosed with Hodgkin's lymphoma. We have a confirmed diagnosis, an expected presentation, and a treatment plan. So this client is scheduled for chemo, so that's a treatment plan. Hodgkin's lymphoma is a malignant cancer of the lymphatic system. Fever is expected in the early stages of the disease, along with painless enlarged lymph nodes, fatigue, fever, weight loss, and drenching night sweats. And this patient's WBC is within normal limits, okay? I have somebody put in the chat box here, a patient with C. diff being treated with Flagyl should also be reported because a fever in spite of antibiotic therapy. Muhammad, you make a great point, but that point is not relevant to the question. It's wanting to know who is of highest priority. So it's not saying that you shouldn't tell the doctor. The physician should know about all of these clients, right? When they round, you should report these findings to the physician. But who is of highest priority? That is what the test question creator wants to know. Okay, so you make a good point, and yes, I agree. But that's not what the question is stating. The question doesn't state, well, who? Select all that apply. Who all should be seen? The question states who is of highest priority. All right, question 4. The nurse assesses a patient 5 minutes after starting a blood transfusion. The patient has shortness of breath, itching, and chills. The nurse immediately turns off the transfusion and disconnects the tubing at the catheter hub. What action should the nurse take next? Number 1, check the vital signs. Number 2, maintain IV access with normal saline. Number 3, notify the healthcare provider. Or number 4, recheck identification labels and numbers. What action should the nurse take next? 2 minutes on the clock here, guys, and go. Alrighty, guys. So coming together and revealing the correct answer would be number 2. And the majority of you guys did get this one correct. Maintaining IV access with normal saline is going to be the highest priority, as this is what's going to help prevent hypotension and vascular collapse and allows for treatment of the reaction via medication such as vasopressors, antihistamines, and corticosteroids. So number 2 would indeed be the correct answer. Now, you would do all of these. All of these are correct actions that you would do. But the test question creator wants to know, what should you do next? What takes priority after you stop the transfusion and disconnect the hub? What do you do next? Maintain IV access with normal saline. Now, number 1, check the vital signs. Monitoring vital signs should be the step after ensuring IV access, administering normal saline, and notifying the HCP. Number 3, notify the healthcare provider. The nurse should ensure continued IV access before notifying the HCP. The HCP will likely prescribe IV meds to treat the transfusion reactions, so a patient's IV in this situation is critical. And number 4, recheck identification labels and numbers. Guys, we got to treat our patients first. Mislabeling blood and administering the wrong blood type are most common causes of a transfusion reaction. However, maintaining IV access takes priority over investigating a potential clinical error. So it would be number 2, then number 3, then number 1, then number 4, if we were going to be putting these in order. All righty. Question 5, and this will be the last standalone question that we have, and then we'll move into our case study together. A patient of the Orthodox Jewish faith with a history of type 2 diabetes is recovering from a total right hip replacement. At noon, the patient ate a lean roast beef sandwich with lettuce and mustard, carrots and celery sticks, and fresh fruit. What would be the most appropriate 2 p.m. snack for this client? Number 1, angel food cake with fresh fruit. Number 2, crackers and low-fat cheese. Number 3, hard-boiled eggs and blueberries. Or number 4, low-fat yogurt. Also mentioning before we start the 2-minute timer, there is a webinar on LearnUpon on American diets. So if you are not familiarized with some of these foods, or if you are not familiarized with American diets in general, please access that webinar and listen to it. Okay, lots of really good information there. So 2 minutes on the clock. What is the most appropriate 2 p.m. snack for a client with type 2 diabetes? There we go. Alrighty, guys, so coming back together, this question is tricky because not only are you looking at it from a diabetic standpoint, but you're also looking at this question from an Orthodox Jewish faith point of view, because there are certain dietary restrictions for the Orthodox Jewish faith that they follow, certain practices. So individuals who practice Orthodox Judaism follow kosher dietary laws, which are things such as no pork, no shellfish, and the separation of meat and poultry from dairy. When meat or poultry is consumed, at least 3 to 6 hours must pass before a dairy product is consumed. Certain foods, including fresh fruit and vegetables, grains, tea, and coffee, are considered neutral and can be consumed at any time. So the correct answer to this question would be number 3, hard-boiled eggs and blueberries. Does this follow the kosher rule? Yes. Is it a good choice for a diabetic client recovering from surgery? Yes. Okay. So let's talk about 1, 2, and 4. So number 1, does this follow the kosher rule? Yes. But is it a good choice for a diabetic client recovering from surgery? No, it's a lot of sugar. Angel food cake and fresh fruit, lots of sugar. So not the best choice for a diabetic. Number 2, crackers and low-fat cheese. Does this follow the kosher rule? No, it does not, because low-fat cheese is dairy. Dairy needs to be consumed 3 hours after the meat or poultry. So this is only 2 hours. So we would be eliminating that dairy choice. And then the same would apply for number 4, as low-fat yogurt is a dairy choice, and that is not following a kosher rule. So that can quickly be eliminated. So the one that we can choose is number 3. Alrighty, and yes, I see some people posted on here that they need to listen to the American Diet webinar. Yes, that is a good option. So after you conclude today's section, listen to your 6 Steps to Question Success webinar, and then listen to the American Diet webinar. All right, let's go and do our case study today. So questions 6 through 10 will be involved in a case study. And what the test question creators at the NCSBN did was they created these case studies on the NGN version of the NCLEX exam because they wanted to see if you can critically think. Can you integrate the nursing process and the clinical judgment model in order to be able to critically think through these case studies? All right, so here's the scenario for the day. SP is a 75-year-old widow admitted to the orthopedic ward. She fell at home and sustained an intrascapular fracture of the hip, intracapsular fracture of the hip at the femoral neck. Past medical history includes a 50-year smoking, severe rheumatoid arthritis, gastroesophageal reflux disease, and coronary artery disease with a coronary artery bypass graft 9 months ago. She reported that since her cardiac bypass, she had engaged in very mild exercise at home. Home medications include Acifex, 20 milligrams PO daily, prednisone, 5 milligrams PO daily, and methotrexate, 2.5 milligrams PO once weekly. Her vital signs are as follows: 99 degrees Fahrenheit, heart rate is 98, respirations are 14, blood pressure is 128/60, and SpO2 is 94% on 2 liters nasal cannula. So moving right along to see our laboratory results. Her WBCs are 7.5 or 7,500. Hemoglobin is 12.1. Hematocrit is 35. Platelets are 156,000. Sodium is 138 and potassium is 4.2. Now I do have to point out to you guys that though on the NCLEX exam, you will be given the normal ranges for your lab values, it's still important as a bedside nurse in the United States to know what is normal. Because if you are doing an iStat, which is a machine that we have that allows you to run labs very quickly at the bedside with a small amount of blood. If you were doing an iStat on a critical patient who is symptomatic and you have a hemoglobin that comes back, or you have a sodium that comes back and it's high or low and it's not within the normal range, you have to be able to recognize that and to be able to act upon what that is, and to be able to understand what critical findings are. So though you may be able to pass the NCLEX exam without knowledge of your labs, you need to know them for practicing here in the United States. All right, medication. So Lovenox is 30 milligrams sub-Q every 12 hours. Docosate and Encina, 1 capsule POBID. Dilaudid 2 milligrams IV Q 3 hours as needed for pain, and Zofran 4 milligrams IV Q 6 hours for nausea. All right, and then physician has ordered to schedule for a total hip arthroplasty stat. All right, so question 6. So our case study is the same. It's the same exact thing that I have read. There are no updates to the case study at this time. Question 6 says, click to highlight which findings place the client at risk for developing fractures. So out of this case study that I read to you, what puts her at risk for developing a fracture? So I'm going to put 2 minutes on the clock. Please type your answer into the chat box. You guys don't have the option of highlighting on your screen, so just put it in the chat box for me, and you can separate them by a comma, and that way they can all go into the same chat box, or I'm sorry, all go into the same question box. So 2 minutes on the clock. Here we go. Alrighty, guys, so coming back together and highlighting the ones that put her at risk for developing fractures. A 75-year-old, this is advanced age, which equals an increased risk for falls. 50-pack year smoking, increased risk for falls. Severe RA, increases a risk for fractures. Engaging in very mild exercises at home, a lack of exercise, guys, can cause fractures. As effects, long-term use of proton pump inhibitors can increase a risk of fractures. Prednisone, which is corticosteroid therapy, long-term can cause osteoporosis. And methotrexate, which is an anti-metabolite therapy, long-term can lead to liver scarring, lung and kidney. High dosage can cause damage, and osteopenia. Other risk factors for fractures include personal or family history of fractures and osteoporosis. So lots of good stuff coming through the chat box for me. So good job, guys. Question 7. All right, so our case study has progressed. It says she was taken to surgery for a total hip replacement. Because of the intracapsular location of the fracture, the surgeon chooses to perform an arthroplasty rather than an internal fixation. Okay, so the labs are 77.5 is your white blood cell count, platelets are the same, all the lab results are the same. Medications are the same, physician orders are the same. Question 7 says, click which characteristic appropriately identifies an arthroplasty or an open reduction internal fixation, which is known as an ORIF. So characteristic, the first characteristic is also known as a total hip replacement. Is this an arthroplasty or is this an ORIF? What do you guys think? I'll give just a few seconds here. Good, yeah, this is also known as an arthroplasty. So if someone says, I'm getting an arthroplasty done, that means they're getting a total hip replacement. What about metal pins, screws, rods, and plates to immobilize a fracture? Does that occur with an arthroplasty or an ORIF? Good, excellent, you guys. And what about replacement of the entire hip joint with a prosthesis? Is this an arthroplasty or is this an ORIF? Good, excellent. That is indeed an arthroplasty. All right, so question 8, the case study is progressing. 6 hours post-arthroplasty, SP has the following vital signs. Temperature is 97.8 degrees Fahrenheit. Heart rate is 132. Respirations are 28. And the blood pressure is 82/50. She is also on oxygen, 93% on 2 liters. So blood pressure is going down. O2 need is increasing. So it says choose from the drop-down menu below. The nurse suspects post-operative blood loss. Choose one nursing action and one parameter to monitor for this client. So what is our nursing action going to be? Are we going to call our RT? Are we going to administer heparin? Are we going to start a blood transfusion as ordered? Or are we going to reinforce the dressing? What do you guys think that we're going to do here for a client who we suspect has post-operative blood loss? And you can put 1, 2, 3, or 4 in the chat box. You don't have to type out the whole thing. I'll give you guys about 30 seconds. Put a 1, a 2, a 3, or a 4. Alrighty, so we're going to start a blood transfusion. We have an order for a blood transfusion. We suspect post-operative blood loss. We've got a low blood pressure, most likely due to low volume. So once we transfuse our client, we get more blood in there. She's going to have an increase in that blood pressure. So I see that some of you put call RRT. Unless it specifically stated that she was symptomatic, dizzy, so on and so forth, I would start the blood transfusion first and then call our RT if the case were to progress and she were to be more symptomatic. Okay, and then one parameter to monitor, are we going to monitor those hemoglobin and hematocrit levels, the pain level, the fever, or the CBC and erythrocyte sedimentation rate? So you could put a 1, a 2, 3, or a 4. Oh, what is RRT? Somebody asked. That is the Rapid Response Team. So they are the in-between, not necessarily you're calling a code blue because your patient is in cardiac arrest and doesn't have a pulse, but you're calling RRT because you suspect that your client is headed in a more critical direction. You will call the rapid response team. They're a team usually of about 2 nurses or so that help with those critical care situations. They have a set of orders themselves that they can follow, policies and protocols that can help to stabilize the client until the physician can get there. All right, and the answer is going to be monitor those hemoglobin and hematocrit levels. Excellent job. Question 9 says, when providing health teaching to SP, the nurse mentions that she is at risk for developing infection, anemia, and bleeding. Which of the following statements are accurate? Select all that apply. All right, our first select all that apply of the day. Number 1, methotrexate can cause leukopenia, thrombocytopenia, or anemia. Number 2, a 50-year history of smoking increases her risk for developing post-op bleeding. Number 3, chronic immunosuppression can result from prednisone therapy. Number 4, SP's history of GERD is not a cause of concern for any post-op complications. Or number 5, it is important for SP to receive iron supplements post-op. So which of these statements are accurate? Select all that apply. So 2 minutes on the clock, guys. Here we go. All righty, so I see lots of good stuff coming through the chat box here. So let me go ahead and reveal the correct answers to you. Which of the following statements are accurate for our client developing a risk of infection, anemia, and bleeding? So it's going to be 1, 3, and 5. Excuse me, pardon me. So number 1, methotrexate can cause leukopenia, thrombocytopenia, or anemia. And this is true. It's an immunosuppressive drug commonly used to manage rheumatoid arthritis. And these are indeed common side effects. Number 3, chronic immunosuppression can result from prednisone therapy. Again, this is a common side effect, okay? Does place the client at risk for also developing infections. And then number 5, it is important for her to receive iron supplements post-op. This would indeed be correct. Iron supplements are important to prevent and manage anemia post-op. A diet high in protein, calcium, antioxidants, vitamin C, zinc, and iron are important for wound healing. So for those of you who put 2 or 4, GERD can put the client at risk for aspiration pneumonia, but it's not going to necessarily cause infection, anemia, or bleeding, okay? And, oh, sorry, I read that wrong. SP's history of GERD is not a cause of concern for post-op complications. It is a concern for post-op complications because it can put the client at risk for aspiration pneumonia. Okay. And then SP's 50-year history of smoking increases her risk for developing post-op bleeding. Smoking can place a client at risk for post-op respiratory complications such as atelectasis and pneumonia. but not related to the bleeding. Okay. And Keith has a great question about getting deductions for picking a wrong answer, and that is indeed true. With the Indian version of the NCLEX exam, you have the opportunity for partial credit scoring for SATA questions. So if you had chosen 1, 3, 4, and 5, you would have only earned 2 points on this question because choosing an incorrect answer is going to have a point taken away. So if you chose 4 and 5 and that was incorrect, those two would cancel each other out. So instead of earning 3 points for this question, you would only earn 2. And then question 10 is another select all that apply. So SP has good progress post-surgery. Throughout her hospital stay, several members of the interdisciplinary team have assisted her. She is now asking you to clarify some roles of the interdisciplinary team. Which of the following statements are accurate? Select all that apply. The chaplain will only offer Protestant-based spiritual guidance. The physical therapist will teach her about proper ambulation, safe transfers, and prescribe ambulation aids such as a walker. The occupational therapist will instruct on independence and activities of daily living, as well as assistive devices to aid in performance of ADLs. Number 4, registered dietitian will assist with medical nutrition therapy, including recommending dietary supplements. And number 5, the case manager will assist SP and her family with placement in a rehab facility after discharge. So which statements are accurate regarding the roles of these particular interdisciplinary team members? All right, here we go. Alrighty, guys, so coming back together and revealing the correct answers. So 2, 3, 4, and 5 are all going to be correct, as these are all appropriate descriptions of the interdisciplinary team. Number 1 is incorrect because chaplains support and encourage people of all religious faiths, not just Protestants. So the other 4 would indeed be correct. So that's all that we have for today, guys. Thank you so much for coming. I hope that you learned at least one thing today. If you are walking away from here with at least learning one thing, then I consider it a successful question clinic. So if you missed any part, if you want to review any more, we do offer the same content again later this afternoon, Florida time, as well as times on Tuesday, Wednesday, and Thursday. So you are more than welcome to attend those as well. But I'll be back again this time next week to present another set of questions to you guys. So thank you so much for coming, and I hope that you guys have a fantastic rest of your day. Thank you and take care.